That brings us to Dr. Anthony Fauci. Dr. Fauci, good morning. It's good to see you.
Good morning. Good to be with you.
Well, we've heard that many states are now seeing, unfortunately, an uptick in cases. The majority of states are kind of plateauing. In other words, they stopped declining. What do you attribute that to?
Well, I think it's pretty clear that there are some states now that are pulling back, I believe, a bit more prematurely than they should on the public health measures. We've been talking about this now for a couple of weeks. The very sharp decline that we had, which was really good news, has now over the last few weeks plateaued at around 55,000 new cases per day. That's much too high to be declaring victory. And that's the concern I and my public health colleagues have, that if you pull back on public health measures when you have a high background dynamics of virus in the community, there is the risk that you are going to rebound. This is exactly what happened in Europe. They're generally 3 or 4 weeks ahead of us in the dynamics of their outbreak, and they saw the same thing. They plateaued, and then they started to take off. And we're seeing that in a few of the states, not all the states, but a few of them are starting to have increases, which is very disturbing.
Are you worried that what we're seeing in Europe, where they are having a big surge, having to shut down again, that could be a preview of coming attractions, that it could happen here, another surge like that?
You know, I am, Savannah. I don't want to just, be a worrywart, as it were, and we have to take this very coldly and examine it in a very scientific way. But this is what happens when you plateau and start to inch up. History has shown us through 3 surges that we've had that's what happens. That's the dynamics of the virus in the community, that it starts to go down, then it plateaus, it inches up, and then you get a surge. It really is going to be a race between the vaccine and the potential surge. So the more people we get vaccinated, that's the reason why the good part of this equation is that every day we're getting 2 to 3 million people vaccinated in this country, which is the good news about all of this.
Yeah, real quickly, before we leave the topic, I mean, the other X factor here is the UK variant, B117, as it's known, being more contagious, many studies showing that it's more deadly, and it is massively on the march here. Is that also something that's a contributing factor?
Oh, it is. When you have a virus that's dominant in the community, that has a better capability of spreading from person to person, it makes the likelihood of a surge even greater. Thank goodness the vaccines that we have work very well against 117, and that's the reason why I keep saying it's a race between the vaccine and the virus. Let's get as many people vaccinated as quickly as we possibly can.
Before I let you go, I want to talk about kids and schools. The CDC now looking into whether 3 feet of distance instead of 6 feet of distance would be okay in a school setting. What's your thought on that?
I think that likely will happen. There was a good study in the state of Massachusetts in which kids who were wearing masks, they looked at 3 feet versus 6 feet, and they really found no difference. So the CDC is analyzing that data very carefully right now. They very well may change. I don't want to get ahead of them, but they are very much on top of this and looking at that data, so they will reconsider about that distance.
Real quickly, could there be broader implications? Could 3 feet be okay for the rest of us? Because I'd like to sit 3 feet closer to Hoda.
It might be, Savannah. Hang on.
Okay.
We'll let you know.
Keep me posted. I'll be the first to know, right, Doctor? Thank you very much. You appreciate your time.
I was just about to scoot over.
I'm ready to inch a little closer.
Hey, thanks for watching our YouTube channel. Find your favorite recipes, celebrity interviews, uplifting stories, shop our favorite deals, and so much more with the Today app. Download it now.